Dr. Susan Kirsch, who's got more balls in the air than anyone I can tell you about, but actually they all land in the right places. So that is just makes her phenomenal to work with. And frankly, the many, many people who are interested. And I do just have to note that what has excited me the most is that one of our network directors has spent the whole time here. That would be Dr. Skye McDougall. You can stand up, Skye. So anyone who doesn't know you does know you. So though I had to travel yesterday, I was hearing from Skye throughout. I just did eye surgery, things like that. So. So it's really a privilege to be with you today. This is really, really exciting. If you think about how many medical gadgets and devices we've had over the years, usually what happens is we go completely crazy, with excess enthusiasm, and then find out that maybe not everyone needs a Swan-Ganz catheter or fill in the blank. But it's really this is about as low risk as it gets, and people enjoy it. Wow, I mean, you just don't get that very, very often. And because we are not dependent on a fee-for-service sort of billing system, that gives us the luxury of, I think, moving rapidly. So the excitement here and throughout, a growing excitement throughout the enterprise really has me very excited. So you've heard from an all-star cast in immersive technology, from those who've been researching and evaluating it for decades, to those who are early adopters, to some who are just trying it for the first time. And the whole point is to get all of those people and many, many more, all of their friends and villages, together to figure out with us, how does this begin to impact what healthcare can look like? By the way, I should just ask, has anyone enjoyed a clinical encounter lately in medicine? Okay, just checking. I mean, when you see and hear from some of these veterans, it's a very, very different experience. I mean, the best is that it's neutral, right? But we'll leave it at that. So over the past few days, we've heard from people like Evan from VA and Immersive, who shared, there's no more exciting part of my job than when I'm putting heads in headsets. Let me just tell you, Evan has been going full-time, overtime at VSO meetings and so forth. It's been really, really exciting to see. And Sarah from OINT, who reminded us that the best way to predict the future is to invent it. I like that one. We're truly shaping the future in VA, and there's much more to do. So these innovations and advancements are game-changing. They demonstrate the power of immersive technologies like virtual reality to transform healthcare across the entire spectrum of clinical care and training and education. I don't know how many of you saw a longish story in the New York Times Magazine, maybe about a year and a half ago. I missed it on virtual reality. Big focus on pain management and mental health. And I tuned in, though, and found it rapidly when the letters to the editor showed up a few weeks later, which was, normally there's one or two, and you think, gosh, who won the lottery this week? Because I'm going to guess they get a lot of letters, but just selectively pick. They printed many, many pages. So it gave me really a feel back then for just how powerful this is. You also heard from Dr. Elnahal, our Undersecretary for Health, who you can tell is a really enthusiastic supporter himself. So it's always great to have full support from the top. And I hope that you won't mind if I just take a brief moment to brag on and note that much of the work you've heard about from the past 2 days is being pioneered by the Dean Office that I have the privilege of leading. I'm immensely proud of Ann Bailey, Caitlin Rollins, Evan Davis, Kim Balicki, and I want to thank them for putting this together this week's summit. And they're only a small representation of a lot that's going on in innovation. As I was leaving, another group is gathering next to my office and promising me not to be too noisy and so forth. And of course, I want to thank Dr. Susan Kirsch for her leadership on immersive technology and her dedication to socializing just how important this is, this innovation is with VA and VHA leadership. So there's no question VA is defining a new reality for veterans in healthcare delivery and experience, and probably leading the world in implementation of this technology. You've heard this statistic several times, but I think it's still important to repeat, although it might have changed, actually, as a result of this already. We've deployed more than 1,200 headsets across more than 160 VA medical centers. Please don't ask the definition of a VA medical center. They're pretty variable. I think 170 is the number we use, and they're quite different. But medical centers and outpatient clinics in all 50 states, Puerto Rico, Guam, and American Samoa. And that is just for starters. Huge range of clinical disciplines, which I think is very encouraging. And importantly, these technologies offer a non-pharmaceutical approach to what can be a daily, if not more often, challenge of coping with PTSD, anxiety, depression, acute and chronic pain, as well as physical rehabilitation and low vision rehab. They also help veterans build emotional resilience, decrease stress, and importantly, alleviate social isolation. That veteran that we just saw in that clip a few minutes ago, you know, the joy of surprise that there could be something positive just comes across, it screams at you just as he's speaking for a few minutes. And this technology also expands veterans' access by offering the opportunity to receive care at their local medical facilities as opposed to traveling to another or frankly from the comfort of their home. I think that will absolutely be the next frontier. So, and as you've heard at this meeting, veterans' reception of this technology has been phenomenal. In late December of 2022, we had the first ever Veteran Experience Day, and this was a demo day for veterans to try out the headsets at our National Simulation Center right next door to the Orlando VA. And then in June of 2023, we had another one similar to that in Sheridan, Wyoming. So this is really, really everywhere. On a scale of 1 to 10, with 10 being life-changing, veterans rated their experience an 8. Wow. First of all, those of you who've ever been in the position of asking patients to put numbers on anything, the first thing you get is enormous irritation with like, what do you need a number for? It really hurts. Now, you know, stop asking me about numbers. 8 though, that's pretty amazing. 94% said they wanted to see more VR in use at their VA facility, as well as have access to more of this in their homes. And there's also the tremendous amount of anecdotal evidence from veterans as well as providers. For example, Bianca Arney, a home-based primary care dietitian from Columbia, Missouri, talked about virtual reality's profound impact on a veteran who is primarily bedbound and socially isolated. And according to Bianca, this patient is sleeping better because she uses her VR, to kayak and for Tai Chi. Imagine that. The improved sleep has improved her mood and lowered her stress. That's just amazing. Additionally, Bianca reports, VR has also improved the veteran's grip strength due to the daily physical activity of using the technology and motivated her to join several groups because now she can socialize and travel, if you will, or connect, but without having to leave home. And we've received accolades from lawmakers and their staff following our first virtual demo day on Capitol Hill this summer. And here's what people had to say. Future, unique, fun, amazing, creative. They also said, why doesn't the DCVA have this everywhere? But that's a different story. We're having that conversation. Secretary McDonough always urges us to keep veterans at the center. And as I noted, it's an incredibly exciting time to be in healthcare. But even in our excitement, we have to stay grounded with some really important questions. Do these really work for patients? Are they understandable and easy to use by all groups? Do they work for providers? What's the evidence? It reminds me of a question we used to raise in my former life when I directed the Agency for Healthcare Research and Quality. We called it the Porter question, named for a member of Congress. He was the chair of our House Appropriations Subcommittee, and he had grilled my late predecessor during a hearing, and he said, so what's the impact of your work? And my predecessor told him about New England Journal articles and JAMA and so on and so forth. And he said, well, that's important, yeah, but what we really want to get at is not how many reports, but how many people's lives are being bettered by what has been accomplished. In other words, is it being used? Is it being followed? Is it actually being given to patients? Well, his focus was on healthcare research broadly. I think the same sort of frame applies to virtual reality. Having a vision is not enough. Even enough proof of clinical effectiveness isn't enough. We have to measure impact, and I think we also need to anticipate challenges with what I'll call a conceptual blueprint for where does this fit into practice. You know, if people come in and they're just going about their routine and there's a bunch of headsets in a closet, it's probably not going to have the impact you've all been imagining this week. That's what I mean by a blueprint. But as our veterans population ages, technologies such as VR can really connect their needs with their care team, which I think is hugely important. And it's important because it increases engagement and satisfaction and better clinical outcomes. Who knew that a homebound primary care patient would increase her grip strength, which could only be a good thing? So we have that unique opportunity here at VA, and specifically in our office, to explore what has yet to be examined or even considered. Through research and development, we can explore uncharted territories in human subjects research. Through academic affiliations, we can create a new paradigm for health professions training, which I think is going to be really, really important. I worry about our trainees right now because they're coming into a system that is trying to figure out what's the new normal. And, by the way, probably hearing from a lot of providers that I'm leaving in 2 months, or I'm not sticking around for this. You know, very, very different than the experience I remember as a trainee, so something that brings joy could only be helpful. And through healthcare advancement and partnerships, we can join together to impact the future of healthcare. So I hope you've enjoyed this, and you have just done a stunning, stunning job, and thrilled that all of you could be here to join with us. So just take this home and spread the word. Thanks for your attention.